Hello and welcome. Today we are going to discuss about pre-malignant lesions. In that we are going to discuss about oral submucous fibrosis. According to the definition, it is an insidious chronic disease affecting any part of the oral cavity and sometimes the pharynx. Although occasionally it is preceded by or associated with vesicle formation, it is always associated with juxtaepithelial inflammatory reaction followed by fibroelastic changes of the lamina propria, leading to stiffness of the oral mucosa, trismus, and inability to eat. Coming to the etiology of the OSMF, areca nut is considered to be the most important etiological factor in the development of OSMF. In some cases, genetic and immunologic predisposition also has been noted. Deficiencies of micronutrients like iron and zinc are also associated with some cases. Areca nut, which is mostly grown in the region of tropical Pacific, Asia, and East Africa. It is commonly referred as betel nut as it is often chewed, wrapped, and betel leaves. It can be chewed in association with the pan, or it can be mixed with gutka and consumed. With the help of this map, we can see major population of Southeast Asia region is involved in the consumption of areca nut and betel leaves. Coming to the pathogenesis, the major areca nut alkaloids are arecoline and arecidine. Arecoline modulates matrix metalloproteinases, lysyl oxidases, and collagenases, all these affecting the metabolism of the collagen, which leads to an increased fibrosis. Hence, there will be production of increased collagen and there will be less number of degradation of the collagen, which leads to increased cross-linking of the collagen, insoluble collagen, which leads to the fibrosis and oral submucous fibrosis. Coming to the staging of the OSMF, Pinbock divided OSMF into 3 stages. Stage 1 includes stomatitis with erythematous mucosa, vesicle formation, mucosal ulcers, melanotic mucosal pigmentations, and mucosal petechiae. In stage 2, fibrosis will be there in healing vesicles and ulcers, which is the hallmark of the stage. Stage 3 will be associated with speech and hearing deficits. Coming to the clinical presentations of oral submucous fibrosis, this can be divided into early and late forms. There will be burning sensation of the oral mucosa, which can be exacerbated by eating spicy food, vesiculations, blanching of the mucosa, restricted mouth opening, fibrous bands within the mucosa, narrowing of the oropharyngeal orifices, distortion of the uvula, increased salivation, change in the gustatory sensation, hearing loss. Here are some of the clinical pictures showing the clinical presentation of oral submucous fibrosis. In picture A, we can see marble-like appearance of the soft palate, osseous pillars, and upper pharyngeal mucosa. In picture B, we can see shrunken uvula, blanching of left buccal mucosa and retromolar region. In picture C, we can see fibrosis and depapillation of the tongue. In picture D, we can see blanching of the right buccal mucosa. In picture E, we can see fibrosis and pigmentation of the lower lip. The clinical photograph in this slide shows restricted mouth opening of the patient due to fibrosis of the buccal mucosa and in the retromolar region. Coming to the lab findings, there will be decreased hemoglobin levels, decreased iron levels, decreased protein levels, increase in ESR, and decreased vitamin B complex levels. Coming to the precancerous nature and malignant transformation of OSMF, malignant transformation rate of OSMF was found to be in the range of 7 to 13%. Diagnosis of OSMF, as such, there is no specific test, but history of repetitive exposure of betel nut, clinical examination, and the texture of the tissue can confirm the diagnosis. An incisional biopsy will reveal a thin epithelial surface and excessive deposition of otherwise normal collagen in the submucosa. Anemia, amyloidosis, oral manifestations of scleroderma, and TMJ ankylosis can be considered under the differential diagnosis of oral submucous fibrosis. Coming to the treatment part, Here, first and foremost, patient has to discontinue the habit, and thorough counseling of the patient should be done. Patient should be encouraged through education and advocacy. Patient should be explained about the disease and its possible malignant potential. Thorough counseling should be given for de-addiction. Then oral physiotherapy also can be considered, in that various mouth stretching and mouth opening exercises can be advised for the patient. Pharmacologically, lycopene, which is a carotenoid antioxidant, can be considered under the treatment modality for oral submucous fibrosis, or we can also surgically excise the collagen fibers. So this is a chart which summarizes the various treatment modalities available for the treatment of oral submucous fibrosis. First one is micronutrients and mineral, which consist of vitamin A, B complex, C, D, and E. Under microminerals, iron, copper, calcium, zinc, magnesium, selenium, and others. Lycopene, 8 mg twice a day for 2 months. In some cases, pentoxifylline also being used, which has shown great results, which is 400 mg 3 times a day for 7 months. Intralesional injections of interferon gamma and steroids can also be advised. Submucosal injection twice a week in multiple sites for 3 months can be tried. Stay tuned for such informative videos. Till then, thank you.